Hello everyone, my name is Laura Gomez, and today I'm gonna be answering some questions evaluating critical thinking about occupational therapy. The first question it says the OT is completing a pre-discharge evaluation after the client's 3 months of outpatient OT following a hand injury. The individual has not been able to work for 3 months and is unable to perform multi-job requirements as a truck driver. Which should the OT recommend as discharge? A home exercise program, home health, OT, or a work hardening program? In this case, the answer will be a work hardening program because we are making a reference about the client not being able to work for 3 months. He is already going home. A home exercise program should be a general maintenance of the situation, something that he should have received as soon as he got the injury. So it's not something that it's not related to what they're asking. And in the sense of home health, home health OT is intended for clients that need occupational therapy at home. We're talking about arrangements around the house, ADLs training. So this is something that is not mentioned in the question. The second question is that an OT is preparing to evaluate a toddler who has upper extremity orthopedic concerns and difficulties with self-feeding while at childcare. How will the OT most likely obtain initial assessment data, measurement tools, that assesses visual motor skills, a dynamometer and pinch meter readings, observations of the child during eating activities in the child care? So the answers for this question will be observations of the child during eating activities, just because we're talking about orthopedic concerns and difficulties with self-feeding, and this is something that we do initially before we do evaluations or anything like that. We observe the client. In this case, that will be the first thing that you do: observe how the client interacts with the environment. We wouldn't do a dynamometer or a pinch meter reading necessarily because these tests are not appropriate for toddlers. There are other tests that better measured some of the ideals and the orthopedic concerns that the child may have. And also the dynamometers and the pinch meter, they're very specific instructions which are difficult for a child to follow. And the measurements tools that assesses visual motor skills, this is something that we do after we start the evaluation if it's necessary, but it's not what we do initially. The other question is an OT working in a long-term care facility needs to evaluate the long-term memory of a resident, which is best for evaluating memory of personally experienced events, declarative memory. And now the answers are: show the person a series of objects and ask them to recall the objects within 16 seconds. Ask the individual how they spend the New Year's holiday. Have the individual state the place, date, and time, or ask the client to remember to bring a specific item to the next therapy session. The answer to this question will be: ask the individual how they spend the New Year's holiday, just because this is declarative memory. This is what it means. It means episodic memory, something that you experience, like a birthday, a traumatic experience, a very, very good trip, which is what the example is. And it also contains the semantic memory, which is memory of facts and knowledge. So, for example, if you were to ask the patient a general knowledge question that everybody should be able to answer, it doesn't matter if your short-term memory is affected. This information is already in your brain and it's not going anywhere. So the answer will be: ask the individual how to spend the New Year's holiday. The other tests and the other options, like for example, show the person a series of objects and have them recall it. This is short-term memory. This is a test that is done immediately, like in the moment you're evaluating their memory recall at the moment that you're doing the test, and not something that happened in the past, which is what long-term declarative memory means. When you're having the individual state, place, date, and time. This is orientation. This is cognition and orientation. And to remember to bring a specific item for next session, that is like a procedural memory. You're asking the client to bring you something, so it's not kind of like declarative. It's something that is considered actually short-term memory per se. Now, the next question. A person with a long history of Parkinson's disease is experiencing considerable fatigue during the day. The best way to enable the individuals to maintain their level of function is to teach them how to work through the fatigue. That's one. Perform desired activity in a simplified manner to conserve energy. Employ pursed lip breathing, or eliminate activities or reduce stress level as much as possible. The answer would be perform desired activities in a simplified manner to conserve energy. People with Parkinson's disease, they experience a lot of fatigues and tiredness, low levels of energy. So pacing themselves throughout the day is the best approach that they can have to perform tasks. Parkinson's disease, unfortunately, is a degenerative disease. It doesn't go away and it doesn't lessen. So this should be one of the best important approaches. Work through fatigue. This is just not recommended. This is something that will lead them to feel even worse. Fatigue is something very common for Parkinson patients. So pacing throughout the fatigue is something that is not gonna work for them. Now, employ pursed lip breathing. Pursed lip breathing is for pulmonary conditions, cardiac conditions. Parkinson's disease doesn't. Is not related to what the person is feeling or what they need. It's not related to fatigue. Lip pursed breathing is not gonna decrease their fatigue levels. And now, eliminate activities or reduce activity levels as much as possible. This is important, but it is not the most optimal question, because we want them to maintain the highest level of involvement in activities. So pacing themselves should be the best option. Now, the other question is, an individual with Guillain-Barré acute syndrome demonstrates poor to fair strength throughout the upper extremities. Which is the most appropriate approach for the OT to use when planning treatment for the early stages? Gentle, non-resistive activities, progressive resistive activities, or fine motor activities? I will say gentle, non-resistive activities, because Guillain-Barré is a progressive autoimmune condition. You can see it affects the peripheral nervous system, so it is something that affects the body over time. The gentle, non-resistive activities facilitates the movement and prevents the muscle atrophy and contractions that are symptomatics of this condition. Progressive resistive exercises is not something that we do in the early stages. It is something that we do later on, and it can actually overstress the muscles. It can make the pulse even more constricted. And fine motor activities is not something that we're working on in the early stages. It's something that we will eventually work on, but not in the early stages. The last question, it says, following radiation therapy for breast cancer, an individual develops lymphedema in the right dominant upper extremity. She is experiencing functional deficits and is referred to occupational therapy. Treatment to reduce the swelling will begin with change of dominant training, right upper extremity exercises using isometric contractions, fitting of compression garments, or a hip modality such as ground compresses. I will say for this question, the answer should be the fitting of compression garments, just because lymphedema is characterized by accumulation of fluid. Wherever you had your injury, unfortunately for people suffering from cancer and doing radiation, and this is very common. The goal is to treat the swelling. I wouldn't recommend a hip modality because it is contradicted for lymphedema, And the right upper extremities, it's just when the lymphedema is acute, is when it's most present. Is not gonna do is not what we want to use to make the person feel better. And the change of dominant training, this can be considered later. It's not something that we should do right away. Also, because this is the patient's dominant hand, it is good to train them on their left hand, but it is not the most optimal solution. And that's it. Thank you.